In this video, we'll describe exercising blood pressure. In addition to resting blood pressure measurement, it's also important to consider measuring blood pressure during exercise. This allows for dynamic assessment of the body's response to a physiological stressor of exercise. In order to make use of this information, it's important to understand the normal and abnormal responses of blood pressure to exercise. The normal response of blood pressure to aerobic exercise is a 10 millimeter increase in systolic blood pressure for each change in workload, roughly 1 MET. There should be a minimal increase in diastolic blood pressure, no more than about 10 millimeters of mercury, and it might actually not increase at all or slightly decrease. Now, blood pressure is generally lower with lower body aerobic activities compared to upper extremity aerobic activities, like arm biking. This is due to the differences in the number of blood vessels undergoing functional sympatholysis, resulting in dilation of the arteries in exercising muscles. Since the muscles of the lower extremities are larger, they possess more blood vessels. Therefore, when they are active, more blood vessels are dilated, and thus total peripheral resistance will be lower, and the net increase in blood pressure will be lower compared with upper extremity exercises, which uses smaller muscles and thus less blood vessels undergoing dilation. Whole body exercise, or whole body aerobic exercise, where every muscle is active, will have the lowest net increase in blood pressure for the same reason. Now, resistance training elicits a much more pronounced blood pressure response. This is due to several factors, including the sympathetic vasoconstriction in non-exercising vascular beds, as well as mechanical compression of blood vessels in the exercising beds. The changes in blood pressure during resistance training are oscillatory and related to the phase of the lift. Now, blood pressure will increase to its maximal value during resistance training during the concentric phase. So if we're doing a bicep curl during the lift part, we will see the highest blood pressure response. Blood pressure will then decline often to resting values during the terminal phase, so once we're already at the top of our bicep curl. And then it will increase again during the eccentric or lowering phase, but it's generally lower than the concentric phase. Now, in terms of recovery, typically systolic blood pressure decreases approximately 10 millimeters of mercury per minute after exercise. After 3 minutes, systolic blood pressure should decrease to less than 90% of peak exercise values. And after about 5 to 6 minutes, blood pressure should return to resting values. Now, this is the same both for aerobic training and for resistance training. In some individuals, after about 5 to 6 minutes of rest, we might actually see blood pressure be lower than it was at baseline. This is called post-exercise hypotension. In healthy populations, an 8 millimeter decrease in systolic and a 9 millimeter of mercury decrease in diastolic has been observed, and we often observe more pronounced reductions in individuals with hypertension. Post-exercise hypotension is also typically more pronounced following heavy resistance training. Now, recent research suggests that the presence of post-exercise hypotension may serve as a prognostic indicator for patients with hypertension, indicating they may respond well to exercise training to manage their blood pressure. Now, 2 key abnormal blood pressure responses to exercise have been identified. The first being an exaggerated or hypertensive response to exercise, also known as HRE. This has been defined as a difference between peak and baseline blood pressures greater than 60 millimeters of mercury in men and greater than 50 millimeters of mercury in women. It's also defined as exceeding a systolic blood pressure greater than 220 during exercise in men, or greater than 190 millimeters of mercury systolic in women, or greater than a 10 millimeter mercury increase in diastolic blood pressure, or greater than 90 millimeters of mercury at any point during exercise. Patients with hypertension are at an increased risk of demonstrating hypertensive responses to exercise, and even in patients with well-controlled blood pressure. However, HRE has been demonstrated in normal individuals and can be predictive of future hypertension. While hypertensive responses to exercise is most often regarding blood pressure measurements recorded during maximal exercise, it has been demonstrated even at low intensities and may be useful potentially for unmasking, again, mass hypertension, because those individuals typically demonstrate a hypertensive response as well. The other abnormal blood pressure response to exercise would be a hypotensive response to exercise, also known as low XBP. Low XBP is defined as either systolic blood pressure drop below baseline or a failure to increase greater than 10 millimeters of mercury during exercise. Low XBP is associated with an increased risk of cardiovascular and all-cause mortality independent of clinical presentation. And the earlier this is observed, the worse the prognosis.